Dear viewers, very nice to see all of you. We have Dr. Sridevi with us. Dr. Sridevi, what are the reasons for the woman to have bleeding from 4th month till delivery? We call second trimester to third trimester bleeding. Is very anxious moment for a pregnant woman. Can you able to explain what are the causes of this bleeding and minimal some kind of knowledge for all our audience? Thank you.
Sure, thank you. So this bleeding we usually call it as antepartum hemorrhage. So antepartum means before delivery, because bleeding is normal after delivery. But if this bleeding occurs, that is while they are pregnant itself, then we call it as antepartum hemorrhage. There are two important causes of this bleeding, and both are related to the placenta. So what is this placenta? What causes this bleeding? One is the placenta has to be attached to the uterus tightly, and it separates only after the baby is delivered. But in this condition, what happens is, even when the baby is inside the uterus itself, it prematurely separates. So when it separates, the area where it was attached, from that area it starts bleeding. That is what is called as abruptio placenta. That means it separates before even delivery occurs. What happens in this condition is, sometimes there will be blood, and along with blood, mainly it will be painful. So that is how you differentiate, you know about this condition. Very rarely what happens is, sometimes it will separate and the blood stays inside itself. So in that type of condition also, you have to think maybe it still there is bleeding, but it's inside the uterus. Another important condition where there is bleeding is, usually the uterus, in the upper segment only the placenta is implanted. Now what happens, instead of the upper segment, it gets attached to the lower segment. So lower means where the cervix is there. So what happens, as the uterus starts growing, this placenta also starts expanding there. Sometimes if you are lucky, no bleeding occurs, it starts going up on its own, that without covering the os. But sometimes what happens is, when this starts, as the os starts opening, or when there is stretching, what happens is, along with that, when there will be some bleeding. So when it is in the lower segment, why we should know is it is in the lower segment is, by an ultrasound we will know it is in the lower segment. That is when they have a bleeding, and usually this type of bleeding is not painful. So there is painless bleeding in placenta previa, whereas in this condition where it separates, there is a painful bleeding. So with this only usually we will come to know. And finally with an ultrasound. So why should we know about these conditions is, when there is bleeding, sometimes we will need to take adequate rest, or we have to monitor the baby more carefully, because the blood supply may be reduced to the baby in case of abruptio placenta. Or in placenta previa, one strict thing is, the doctor should also be doing an ultrasound scan and should be aware that the placenta is down. Because sometimes when we try to do a vaginal examination, that may increase the bleeding. And this bleeding, when it starts occurring and there is increased bleeding which cannot be controlled, then it has to be delivered. We cannot wait for the baby to attain its maturity. So before that itself, when it's minimally itself, we have to identify this bleeding correctly. For example, if it is in the lower segment at 32 weeks, adequate rest, we should not walk or move around. So that will help us to carry the pregnancy a little longer, because once the bleeding becomes more severe and it doesn't stop, then to save the mother's life, we have to terminate the pregnancy. That is, take out the baby irrespective of whether it is attained the full maturity or not. That is why this bleeding is very, very important. And when they have this bleeding, what we should be aware is, even after delivery, there's a higher chance of bleeding. So we should know their blood group, and we should be able to arrange adequate blood, because the blood is being lost. So we want to replace the lost blood with adequate amount of blood. So blood should be available, cross-matching should be done. So this is about the bleeding.
Yeah, mainly two conditions. Another local condition, very rarely is possibility. One is placenta separates before delivery. Normally it's axonal hemorrhage. That can, the patient will feel the pain. Doctor examines, they have tense and tender uterus. Fetal heart may not be there. Immediately has to be delivered. Delivery can happen by giving some injection and expulsion. That's a treatment. Or if not, probably sometime rarely you have to do a cesarean section to save the baby or save the mother. If you don't do that, they have all the complication in the world. They have coagulation problem, bleeding can go. That is about one. Second, placenta in the lower, that most of the time it needs to be operated. If it is minor degree, it will, as doctor said, it can go up, then no problem. Otherwise, it has to be operated. And don't examine in a just like that in a labor ward. It has to be in a double setup only they have to examine. Otherwise, they can bleed a lot. This is about placenta previa, placenta lower. These are the common causes, and this has to be monitored. You have to go immediately to the doctor. Anything, this bleeding in the second, it cannot be taken lightly. The one point we want to say, you have to go immediately. Another advice, if possibly, don't eat anything and go. If at all, have some juice, because they have to do some immediate intervention. If you full stomach, it will vomit out, it can go to the lung. These are the things, and have blood in ready. Some attendant to give blood or whatever it is. Then you can save the patient. Okay. So thank you very much.
Thank you.